They told them they were being treated, but the treatment never came. This is not conspiracy. This is the record. And what they did became something worse than a crime. It became a template. 1932, Tuskegee, Alabama. The United States Public Health Service recruited 600 Black men, most of them poor sharecroppers in Macon County. 399 had syphilis. 201 did not. They were told, "You have bad blood." They were promised free medical exams, free meals, and free burial insurance. They were never told the truth. The truth was they were human subjects, being observed, not treated. The study was designed to document what untreated syphilis did to a Black body over time. That was the science. That was what your tax dollars funded. Samuel Carter used to chase his son through the fields after work. But as the years passed, the running stopped. His energy drained and his legs gave way. Instead of running, Samuel just watched, sitting on the steps with a weak smile. When his wife asked, "When will the medicine start working?" Samuel had no answer, because there was never any medicine at all. His medical chart was stamped, "Treated." By 1947, penicillin had become the standard treatment for syphilis. Soldiers had carried it to war. Hospitals were stocking it. The men in Tuskegee, they were locked out of the cure. The researchers had the medicine in hand. They made a decision, and they kept watching men die. Not only that, in 1934, they gave doctors in Macon County a list of the study participants and asked them not to treat these men. In 1940, they did the same with the Alabama Health Department. They didn't simply withhold treatment, they actively blocked it. I have read many files. I know how systems work. I know what institutional decisions look like when profit or power or ideology sits across the table from a human being. I thought I was prepared for everything in this file. I did not expect the women. The study enrolled the men. The study observed the men. The study is named for the men. But the disease did not stay with the men. Syphilis is a disease that moves through intimacy, through trust, through the most private part of a marriage. The men went home to their wives. Their wives did not know. No one told them. 40 wives were infected with syphilis because of this study. Ruth Carter trusted her husband. Her husband trusted the government. The government was using her husband and never once considered what that decision would do to the woman sleeping beside him. She did not get a letter. She did not get a pamphlet. She did not get a warning. She got a disease she never consented to. 19 children were born with congenital syphilis because of this study. They were born into a body that had already been compromised by a decision made in Washington before they took their first breath. The Creator didn't make them that way. the Public Health Service did. It was not until 1975, 3 years after the study was exposed, that the wives and children were added to the health benefit program. As of 2026, participants' children are still receiving medical benefits. Children of this study are alive right now, still receiving care for what the government did to their families. The study ran for 40 years. It ended because one man could not stay silent. Peter Buxton, a government employee, a whistleblower. He leaked the story to a reporter. The Associated Press published it on July 25, 1972. Public outrage forced the study shut. By then, 28 men had died directly from syphilis. 100 more had died from related complications. 40 wives had been infected. 19 children had been born with congenital syphilis. In 1974, a class action lawsuit resulted in a $10 million settlement. In 1997, President Clinton issued a formal apology. An apology. For 40 years, for 128 men, for 40 wives, for 19 children. Words on a podium, decades after the damage was done. Tuskegee was not an isolated horror. It was a documented pattern. The same public health service that ran this study also conducted experiments in Guatemala between 1946 and 1948, deliberately infecting prisoners, soldiers, and mental health patients with syphilis without their knowledge or consent. The American researcher in charge of the Guatemala experiments was also a lead researcher at Tuskegee. The same man, 2 countries, 2 experiments, the same decision. Some lives are acceptable losses. If you can convince a community to trust the science while hiding what the science is actually doing, you can control the narrative for generations. And then you can point to the distrust you created and call it irrational. It is not irrational. It is documented. Okay, one classified drop before this file closes. Search Guatemala Syphilis Experiment, 1940s, John Cutler. Read what you find, then ask yourself why that name appears in both files. Samuel Carter never got his cure. Ruth never got a warning. The children never had a choice. But their story is the cure if we choose to do something with it. Medical mistrust in Black communities is not paranoia, it's memory. It is 40 years of a government study, 40 wives, 19 children, a cure in a vial that a doctor chose to put back on the shelf. That memory is not a barrier to healthcare. It is a reasonable response to a documented record. This is Agent Naomi Eden. If you have ever walked into a medical office and felt something you could not name, a hesitation, a guardedness, a quiet voice telling you to pay attention, that is not weakness. That is the memory of Ruth, passed down through generations who never had a name for what they survived. Now you do. file is yours now.